Welcome to the Prudential Medical Clinic Employee Health Insurance Proposal. At Prudential Medical Clinic, we remain committed to our employees' health and well-being, as we believe healthy and more motivated employees will help us to serve our patients' needs. As a part of that commitment to our employees, we offer them a competitive compensation benefits package. As a part of this compensation benefits package, and in order to enhance it, we would like to provide a group health insurance plan. This group health insurance plan will be directly purchased from one of the major medical insurance providers, and it will be optional, and our employees can opt out of coverage if they desire to do so. By offering a group health insurance plan to our employees, we will be able to better recruit knowledgeable, skilled, and dedicated employees. We can also increase our employees' morale and retention. It'll help to decrease the costs associated with higher employee turnover, such as recruiting and training costs. And we'll be able to better provide patient care because our employees will be of a higher caliber. They'll be more knowledgeable, skilled, and dedicated. In turn, this will increase our own reputation, which will in the long run help enhance our long-term profitability. The group health insurance plan that we choose should meet several criteria in that it must meet the needs of our employees and our own needs in furthering our business operations. It must meet the needs of our employees through offering adequate coverage. Wherever our employees do have an issue, they can find an adequate number of different medical providers to choose from. And this plan should allow for our employees as well as their immediate family members, spouses, and children to be covered. The plan should then be affordable to our employees and help them to be able to offset the cost of insurance without breaking the bank. The health insurance plan that we do choose from should also meet our own needs of furthering our business operations by helping us to recruit and retain a higher caliber of employees and be affordable for us, and that it should fall within our own budgetary constraints. After conducting much research on the different types of health insurance plans, we have been able to narrow down the options, so to speak, to two different plans. The first plan is a point of service plan, or POS, from Anthem Blue Cross and Blue Shield, and the other health insurance plan is a health maintenance organization, or HMO, from United Healthcare Group. The POS from Anthem Blue Cross and Blue Shield is a type of managed health insurance plan. It is also a cross between a preferred provider organization, or PPO, and a health maintenance organization, or HMO. It is similar to an HMO in that it requires paying a monthly or annual premium. However, unlike an HMO, it is less restrictive, and that allows for greater access to out-of-network coverage or providers, similarly to a PPO. It is, however, more expensive than an HMO. The HMO provided by United Healthcare Group is also a type of managed health insurance plan, and that requires paying a monthly or annual premium. It is less expensive, though, than other forms of insurance, but also more restrictive. And then it does restrict coverage to a certain number of in-network providers, or in other words, out-of-network coverage is going to be restricted, and minus a few exceptions, it will not be provided. In other words, unless it's in a medical emergency where the patient is knocked out and the insurance company has to provide coverage by law, the patient will be responsible for paying all the costs of care if they go out of network. And again, if it is not a medical emergency where the patient is unconscious. Under both health insurance plans, the person who is insured will be required to select a primary care physician, will also be required to obtain a referral in order to see a specialist, and both plans do not provide for health savings accounts, or HSAs. They are not eligible for them. The cost breakdowns for both health insurance plans are as follows. The monthly premiums under the POS by Anthem Blue Cross and Blue Shield per month cost $304.93 to employees, and employers $304.93. However, for the HMO provided by United Healthcare Group, the monthly employee costs are $236.79, while the employer costs per employee are $236.79. So it is cheaper than Anthem Blue Cross and Blue Shield's plan. The copays under the POS plan are $45 to see a primary doctor and $90 to see a specialist, while under the United Healthcare group, it will cost $30 to see a primary doctor and $60 to see a specialist. The annual deductibles that must be reached before coverage can be provided under the POS are $3,000 per individual and $6,000 per family. Under the HMO, it's $2,500 per individual and $5,000 per family. The out-of-pocket limit for the POS is $8,150 per individual and $16,300 per family, while under the HMO, the out-of-pocket limit is $5,800 per individual and $11,600 per family. For emergency/hospital visits, under both plans, emergency room visits will cost $500. However, under the Anthem Blue Cross and Blue Shield plan, ambulance and physician/surgery fees will require 0% of the coinsurance to be paid after the deductible. In other words, free of charge. However, under United Healthcare Group's plan, for ambulance and physician/surgery fees, it will cost 20% of the coinsurance to be paid after the deductible. So it is going to be cheaper for the Anthem Blue Cross and Blue Shield. However, under the United Healthcare Group, it is cheaper to seek urgent care and only costs $50. For Anthem Blue Cross and Blue Shield, it costs $100. The prescription drug formulary for both plans is a little bit more mixed. Under the United Healthcare Group, Tier 1 preferred generic drugs have a copayment of $10. Tier 2 generic drugs have a copayment of $40. Tier 3 preferred brand drugs have a copayment of $140. And Tier 4 non-preferred drugs have a copayment of $300. The reason that it's a little different is when you get to Anthem Blue Cross and Blue Shield's plan, it has a 3-tier network. Out of network, where the person will be paying all the costs of care. However, it has 2 more tiers. It has in-network for Tier 1 drugs. It has a copayment of $15. Under Tier 2 drugs has a copayment of $60. Tier 3 drugs have a copayment of $100. And Tier 4 drugs have a copayment of 20% of the insurance must be paid after the deductible. However, the other tier is a preferred network. In other words, where you have in-network, and then you have another one that's within network that's more preferred than other in-network providers of drugs. Under the preferred network, Tier 1 drugs have a copayment of $5. Tier 2 drugs have a copayment of $50. Tier 3 drugs have a copayment of $90. And Tier 4 drugs have a 20% coinsurance that must be paid after the deductible. Both plans do not charge for well baby care. After weighing all the different costs and features and restrictions of both plans, it would be best for the higher-ups at Prudential Medical Clinic to purchase the Anthem Blue Cross and Blue Shield plan. The reasons for this is that it offers greater flexibility and access to care. Because of its nature of being a POS, or point of service plan, it covers both in-network and out-network providers, which would be very beneficial as many of our employees are older and would benefit from the greater flexibility offered. In addition, it is affordable. The costs are not that much more than the HMO, and given the flexibility, it is well worth it. In the end, providing group health insurance to our employees and going with the POS offered by Anthem Blue Cross and Blue Shield will help us to reduce employee turnover costs, raise our employee morale, and improve our reputation for providing superior patient care, which in the end will offset any costs of providing group health insurance and increase our profitability. If you have any questions, please feel free to reach out to me at email@emailservice.com.